So one of the more common things that we see as chiropractors, physiotherapists, and osteopaths is sciatica. And sciatica is not really a diagnosis. I know it is technically in the ICD-10 diagnostic vernacular, but it's really a symptom, right? It's pain or irritation of the sciatic nerve. And the sciatic nerve is running from here down the middle of the posterior thigh and down, and it'll come around the medial side, and there's another branch of it. It's actually two nerves together. It's the tibial nerve and it's the common peroneal nerve, and they're bound together. So from about here to here, we call it the sciatic nerve, and then they split into the peroneal nerve and the tibial nerve down here. And these nerves are long, so we can use that length to release them end to end. They often become adhered to things. Now, we're going to just talk for a moment for an example of a long tract nerve treatment, Piriformis Sciatica. Now, one thing is you always have to palpate, because as you've probably read, there's great variability in the sciatic nerve. Sometimes it comes out under the piriformis, sometimes it comes out over it, sometimes through it, just sometimes it splits and goes around it, so you got to palpate and feel it. Luckily, we teach you to palpate nerves all over the body. The sciatic nerve is big, probably big around as your finger. So if we come down here, most people don't check medially enough. We come down here, it's got a texture that's kind of like a penne pasta kind of texture. I don't know my pastas that well, but don't quote me on that. What else could you get it mixed up with? How do I know I'm on it? The only other things that have fibers running that direction is the sacrotuberous ligament, really. But we can check it. If we take his leg and he moves, he just flexes and extends his knee like that. The only thing, that won't move the sacrotuberous ligament, right? It'll move the hamstrings, but they're way down here, okay? So the only thing it'll move under my finger is that nerve. So then I can follow that nerve up, and I'm seeing, is it moving? Is it stuck to the piriformis? Is it stuck to the gemellus? Is it stuck to the obturator? So when I get up here where it dives under, it disappears, right? I can't feel it when it's under the piriformis. So he's got normal morphology of the nerve. If it gets stuck there, I'm going to treat that. I'm going to come around the table. I just want to stand back here so you can see. So I'm going to treat that, and we'll do a full, scoot a little forward, Paul. We'll do a full long track. So Paul's going to flex forward, right? By flexing forward, he's got the nerve pulled up from where my finger is, and the hips relax, so the nerve is relaxed. We're going to leave the hip like that, and then we're slacking the nerve down here at the knee. So now I'm just going to, I've got my spot. So what we're going to do here to move it is I want to move the nerve that way and hold the muscle that way. So I'll hold the muscle here, and Paul's going to extend his back a little bit. That slackens the nerve, and now he's going to straighten his knee, and I'm pushing the nerve with my right hand and holding the piriformis back with my left. And now I'm going to switch my contacts, and he's going to flex his knee, and now he's going to flex his spine and pull that nerve up. Now that's one example of treating one spot where this nerve can get caught, and it gets caught a lot of spots, from the spine to the psoas to the QL, and on down into the hamstrings and the lower leg. So we're going to teach you how to treat that, and the femoral nerve and the common peroneal nerve, and all the nerves of the upper extremity in our nerve course. So if you're having patients, you're having trouble getting Piriformis Sciatica better, come in and take one of our classes, and we'll teach you that and more. Thanks a lot.